Welcome back to K24 Alpha J. We're now counting down to the last 30 minutes of the show. And before the commercial break, we were talking about breast cancer with Dr. Andrew Odhiambo and Susan Ngutu, who I'm so happy that you're here today and we are getting to discuss this particular topic. And, you know, before the commercial break, we were talking about the different risk factors that we have out there. And maybe, Susan, I can ask you, do you at any one given point sit down and think, what if this breast cancer comes back?
No. I don't think about that because I'm a strong believer that I'm healed. Yes. Okay. I have no fear that it will relapse again.
Okay.
Yeah.
All right. And Dr. I was just asking you when we were off air that, you know, there are some cases where a patient is declared cancer-free and then a few months after or a few years later, it's back. What actually happens during this time?
So the way cancer behaves is unpredictable. Yeah. And we as scientists are trying hard every day to understand the behavior of cancers and to try and predict, you know, short-term and long-term survival using various characteristics. So your cancer can be cured, it can disappear, we can do the scans and there's nothing, and 5 months later, it's back. It's just how some of them behave. And having been treated for breast cancer is a recognized risk factor for getting another breast cancer, okay? And having been treated for one cancer doesn't prevent you from getting another cancer. You know, we've had patients treated for breast cancer and then 20 years later, you can develop a new breast cancer. The same breast cancer may come back, or you get another different cancer, maybe lung cancer, who knows? Because some of the treatment modalities we use can predispose you to getting secondary malignancies, and this needs to be discussed with the oncologist about the risks and certain things. So you may be cancer-free today, and a few months later the cancer has come back because of just how the cancer behaves, and it is really difficult to predict, you know, when this is going to happen. I always explain to patients, it is as random as the way, you know, sometimes lights disappear in your house and you wonder, why is it only my block and not the other block? It's purely random. It's something we still don't understand fully. We are trying. We try to risk stratify the women, and there are some whom we know they are at a higher chance of relapse, and their follow-up is more strict. Remember I talked about the triple negative breast cancer group. We cannot follow those women the same way we follow those who are estrogen positive, because we know their behavior is a bit rampant, so their visits will be shorter. You know, we'll have to examine them at a shorter interval. We might have to do scans every so often just to make sure that we are on top of things. And if anything happens to them, the faster we get to diagnose the relapse, probably the better for them.
Okay, so how is breast cancer diagnosed?
So breast cancer, simply when you get the lump, it must be examined by a doctor physically. You must undergo some type of imaging test, be it an ultrasound or a mammogram. Remember, if you have breast cancer on one side, it might be on both sides, but you don't know. So both breasts have to be checked with some type of scan, maybe an ultrasound or a mammogram.
So even if you have a lump on one breast, the other one has to be checked?
It has to be checked because it might be sick, but none of you can feel anything, and it will only come out on the scan. And sometimes we've had patients go into theater, have one breast removed, only for the other one to continue growing when something could have been done for both lumps at the same time. And then on top of an imaging test, then you must have what we call a biopsy test, where the doctor gets in with a needle and removes a block of cells, and those cells have to be examined on the microscope, and then that is what makes the cancer diagnosis. So there are those three elements that have to be fulfilled. And then once that is done, then we have to do whole body imaging to stage the disease so that we know whether it has spread to other places or not. And we can do this easily for stage 1 and 2 breast cancer just with a simple chest x-ray and an ultrasound. We are able to get the correct information. Sometimes those who have stage 3 breast cancer, we might need to do a computer scan, a CT scan, just to make sure everything is okay. And then a certain category of patients, we will send them for what we call a bone scan, which is a special scan that looks at your bones to see whether the cancer may have gone to the bones. And then it is after that, then we decide on the sequence of treatment. It might be chemo, surgery, and then the rest of the treatment, or it might be surgery first and then the rest of the treatment. There are some women whom we can do breast conservation, meaning we don't have to remove the entire breast. We can save the breast and just remove the lump. And there are those whom we cannot do breast conservation and we have to remove the entire breast.
Okay. So what really does accelerate the spreading of the cancer?
So one myth which I must demystify here is many people think that having the biopsy or having the surgery makes the cancer spread. That is false, because the most effective and the cornerstone of treatment for breast cancer and true for many other solid tumors is surgery.
Okay.
I mean, we can't argue with that fact. It's been there since the 1900s, it's known. So good surgery is curative. Having a biopsy is how you make a diagnosis. Both those things, if done well, they don't facilitate the spread of the tumor. It's only because most patients, maybe they went for surgery and then something happened and the patient died, so they associate the death with the surgery, whereas the death would have occurred anyway without the surgery.
Okay, I just want us to pick a call real quick from Linda. Linda from Kisumu. Good morning.
Hello?
Hi, good morning. How are you, Linda?
I'm fine. How are you?
I'm great. Do you have a question or a comment?
Yeah, I have a question.
Yes, please. Yeah.
Okay. Yes, Dr.
Yes.
I was around the 26 years. Right now I'm 30.
Okay.
But I had my first child when I was 26. And then after 6 months, I had a lump on my right breast. So when I went for checkups, I went for a gynecologist. Then the gynecologist referred me to a second doctor who did for me an FNA cytology test. Then I was told that because I take a long time, I always go to work morning and I come in the evening. I take a long time before I breastfeed my child, so a lump can be there. So he took a test in the lump, and I got the results after 3 weeks. That it was a son of galactose. Galactosine was not galactose. So I was wondering, because the lump is still there, is it risky for me or is it just normal?
So a galactose may be common when you're breastfeeding, and it's probably just a collection of the milk and milk products in the breast. It is prudent that you have continuous observation. Remember, not all breast lumps are cancer, so maybe after about 6 to 8 weeks you need to go and be checked again, probably with an ultrasound, and have a full evaluation by a breast surgeon, so that they can feel the lump, feel the consistency, so that if anything changes, then we can repeat maybe an FNA or do something else. But it's common to have lumps when you're breastfeeding, and they are most likely just going to be containing milk and milk products. Sometimes it could become infected, so you also have to be on high alert. If there's pain, if there's fever, then you have to see your doctor for antibiotics.
Okay, so thank you very much.
But,
yes.
Yep.
Doctor, I've seen a guy now, I've seen a surgeon, and the surgeon told me that when it's not painful, then it's not risky for me. But if I need a surgery, he can do for me a minor surgery. Is it okay?
A minor surgery?
Yeah.
Well, it depends. Have you done a breast ultrasound?
Yes, I've done a breast ultrasound.
And what were the results of that?
I don't know how to interpret the results, but I have the pictures.
Or did the doctor explain to you what they found on the report?
The FNA test, or the doctor to read the pictures?
The ultrasound report.
No, he didn't tell me.
So you probably need to go back to him and ask him or her to explain to you what they found on the ultrasound, and whether you need to do another ultrasound after some time to see whether anything has changed.
Okay.
Yeah.
Okay, thank you.
You're most welcome.
Thank you.
Thanks.
Thank you very much, Linda. And maybe I think one of the biggest questions that people have on our social media platforms is how they can get in touch with you and where they can get doctors who can help them through this.
So sometimes it's hard to find a doctor when you need one. So most of the cancer specialists who, for example, work in Nairobi can be found maybe in Kenyatta National Hospital, because I work there myself. I'm also a lecturer at the University of Nairobi, and I also work at the Nairobi Radiotherapy and Cancer Center in Kilimani. But if you're truly stuck, you know, you can just go to the medical board and tell them to give you a list of all the board-certified cancer specialists. We are not so many, just about 27. And you know, also cancer care is multidisciplinary. Yeah. And we have referral systems, we have referral chains. So the doctors who will see you in the periphery, in the small little hospitals, they know us, they know all of us because we are not many. Okay. We have a society called the Kenya Society of Hematology and Oncology. You can contact us through that platform. I'm the secretary, and we can be able to link you with the correct specialist should you need surgery or should you need a special test, so that we can refer you to the appropriate person. Okay.
All right. So I'll have to leave you guys and move to the other side. As I promised you guys that we have another group of very interesting people, and I'm calling them a group because there are two. Where two are there? Hi, how are you? Karibuni sana to K24 Alfajiri. This is a team from EDAs Hope, and I'm sure you've heard about EDAs Hope. Please introduce yourself to our viewers.
Hi, my name is Victor. Victor Choborion. I'm the resource mobilizer at EDAs Hope Cancer Foundation.
Okay. And I'm Magdalene Mukami, Outreach and Communications Coordinator at EDAs Hope.
Right. So for someone who's never heard about EDAs Hope, maybe you can explain to us what you guys do.
Our foundation was started in 2012 after the demise of our founder's mother. She actually passed away she succumbed to breast cancer. She had lived with it for some time, and at that moment our founder didn't know anything about breast cancer. Yeah. So the number of times he went to the doctor with her mom, the little information that he got, he'd post it on Facebook. So it all started as a Facebook group. Then it grew until it was set up as an NGO. Then we started creating awareness. The team started growing until this time where we're around 5 at the office, but we have numerous, a large pool of volunteers that we tap into. For instance, Dr. Odhiambo.
Absolutely. Yeah.
So our main mandate is to create awareness and to reach out to every youth in the country and tell them that cancer is not a death sentence. As long as it's discovered in the early stages, as the doctor has said, it's treatable, it's manageable.
Because most of the times, just to add on what he's saying, most of the times we do not know what it is. Yes. And as much as we think we are in the technical or the internet age, even at that, there's so much information out there that, as you said earlier on, that you go on Google and it's a death sentence. Absolutely. Yeah, you know, so breaking it down and telling people, okay, calm down, breathe in. All you need to know is what exactly you need, the steps. So let's say, for example, right now we're talking about breast cancer. What are the steps you need to take? We're telling people, do a self-breast check. Get to know the status of your breast. Then after that, we tell you, go to the doctor. Within Nairobi, there are very many hospitals that offer breast cancer screening. So that's the kind of awareness we're creating, and just more or less working with people through the journey in a sense. Yeah.
And I'm just so happy to see a man here, you know, being at the forefront, you know, talking about and creating the awareness of breast cancer. And I don't know why you feel the importance of you as a man to voice it out there and tell people, yo, listen, this is real. It's happening, and it's just not about women. Even men are at risk of getting cancer.
One thing I believe is, one thing our foundation stands with is, women are the gatekeepers to men's health.
Absolutely.
So I believe it's our duty as men to watch over our women as well, as the head of the family in that sort. Yeah. So when you're with your partner, when you're with your sister, your mom, it's important to talk about these things, because for a long time people don't talk about breasts. It's sort of a taboo to sit with your mom and start talking about breast. So when I sit with my mom, when I sit with my sister, when I sit with my female friend, I try and engage them in conversations. When was the last time you did a self-breast exam? Because it's a 3-minute long exam. You just lift your hand, check your breast, feel for the lumps, any nipple discharge, and the other signs and symptoms that the doctor has mentioned. So for that 3 minutes in a day, take your time of help your mom do the chores, help your sister do the chores. It's not a long time. And for men, we don't talk about it. We don't talk about these things. So we need to open up. It's important for us to open up for us to win this fight against cancer.
All right.
Yeah.
And before we actually went on air, the three of us were talking about the mastectomy breasts. And Magdalene, you're very passionate about this one so much. I remember you saying, you know, people don't understand that they're actually there and they can help you. Can you just talk to us and tell us the importance and how they can come in handy?
So we acquired 600 mastectomy bras from Canada. And for the longest time, personally, if I'm speaking from a personal point, it was, I just heard about it. There are mastectomy bras, there are breast prosthesis, as much as I work in a cancer foundation. So when we got them, it was from a point of we have them and we need them to get to people who need them. Now, a mastectomy bra is an equipment, it's a post-mastectomy equipment used for the support of women who have undergone mastectomy. And which mastectomy, as Susan has explained, is when the breast is removed.
Partly or completely.
Partly or completely. Yes. So they come in a pair in the sense that for you to be able to use, to make full use of a mastectomy bra, you need an insert, which is a breast prosthesis. Okay. So a breast prosthesis is the mold that simulates the breast. And so according to the size that has been prescribed by the doctor, of course, under guidance, you insert it within the mastectomy bra, and it gets to simulate
fill up the boobs.
Exactly. We actually came with them.
And you came with them. I don't know whether Shiro can help us in just bringing the bras on set. I think they're somewhere in studio. She can actually just help us with that, so that the viewers can understand how to wear them. Because that's another thing, and especially when you have one breast removed. Yes. How do you just wear them? And are you supposed to sleep with them?
Like a normal bra?
No. Okay.
You know, like a normal bra, no. And I think Susan would be at a better position to actually share with us her process of going through. Because as she was sharing with us, and as she said before, she had to put over the scarves when she's going outside.
So here we have it. Thank you, Shiro. We have them here. Thank you. All right.
They're different kinds.
Okay. So they come in different sizes,
So they come in different sizes and different materials. Like right here, maybe you can feel it. This is one that has been covered in a cotton cloth.
Okay.
And inside is fiber.
Okay. And it's very soft.
It's very soft.
Yes.
It's very light.
This is another one,
This is now a silicone.
It's a bit heavy?
It's a bit heavy. Compared, you know, as much as we carry, for the different sizes of breast that we have, we never tend to think about the weight of our breasts. But when you undergo such a procedure, you come to realize, if at all it's not, according, of course, under guidance of the doctor, you're told which prosthesis would work for you best. And this is the bra.
Okay.
So this one, we already had some inserts put in there. And those are the pockets that we were talking about.
All right. So you can remove.
You can remove.
Wash the bra.
Wash the bra. How is it different from a normal bra, if I may ask you?
This right here, it has pockets. Where it can accommodate the breast prosthesis.
I just want to see whether this one can fit in there. Can it
size? Let's look for another size where.
All right.
Which can fit that.
Okay. So you just have to wear if the mastectomy has been done on both boobs,
you'll have to wear. You'll have to get a pair of prosthesis, breast prosthesis.
All right. Okay.
So there's this one that's actually already dressed as well.
Yes. Okay. All right. And the feel is just the same.
It is. It's meant to feel like the normal breast. So that and as he'd said that reeling men in the conversation for women who are in relationships and women who are in marriages, talking to cancer survivors who've gone through this, they share that it is a challenge, and it takes patience, it takes understanding to walk the journey with your significant other, because it's something that was there, it's something that attracted you, perhaps, you know, and all of a sudden, because of breast cancer, and it's been undergoing a mastectomy, it's been removed, and now you have it's actually like starting another life, starting to live another life.
And there are actually cases of where men have left their partners because of undergoing the mastectomy. Because I don't know, the last conversation that we had with Susan, she mentioned that breast it's what makes a woman. I don't want to be sexist in any way, but the general feeling is breast is what make a woman whole. So when she loses the breast, one or either or both of them, she doesn't get to feel like a woman anymore. So most of the men walk out.
Absolutely. Then there's the stigmatization
as
well, you know.
Exactly.
Like, how do you cope with this? How is society going to look at you?
And there are people, some who are lucky to get the support from their families, from their friends, from their church, from their workplaces, because, you know, you spend 8 hours at work, and you need that some level of support. But then there are those who are unfortunate when their husbands get to leave, they're ostracized within the community. It's really difficult. I might not say it, explain it in its entirety, but it's really got a process.
And the two of you have done so much, you know, in creating awareness. But still, the big question is, what are some of the challenges that you are facing? And do you think, as a country, we are doing enough just to create awareness?
I don't think we've got to where we are supposed to be. Because if you look at the human resource allocated to cancer, the number of oncologists in the country at the moment, compared to the population that is existing, it's a drop in the ocean. And then in terms of creating awareness, I feel like cancer is at that point where HIV was when it just came in.
Started,
So there's still a lot that we need to do, because a lot of people don't bother with it. As long as it hasn't hit my home, I will not bother with it. But the moment you lose a friend, you lose a sister, you lose a family member,
it hits home.
It hits home, and then that's when you realize this thing is real.
Okay. Magdalene, how can we, what kind of challenges are you facing as an organization?
One would be finances.
Funds.
Okay. We, as a non-profit organization, trying to get this word out there, that will be one of the main challenges that we face. However, that notwithstanding, we have gotten a lot of support from the public through the campaigns that we've had, and now this one that we are that is dubbed "Breast They Need Your Support," where before we have gone to the public and asked for the public to come through and support us in terms of carrying out some of our campaigns. Like a while back, we had a campaign that we donated, of course, in partnership with a media company. We partnered and we donated equipment to Kenyatta National Hospital Children's Wing, and from as we go to, you know, just do a checkup and see what they're doing, it's being utilized. So those small efforts are what, and support of the public are what keep us here, keep us going, knowing that there is a need. And particularly, if I may talk about the campaign that we are running right now, which is the Breast They Need Your Support campaign. We are saying, yes, breasts, they need your support. We have the mastectomy bras, 600 mastectomy bras and breast prosthesis that we need to, we ideally would have given them to women within Nairobi. Because there's the need within Nairobi. However, there's a lady in Kakamega. There's a lady in Kisumu.
In Lodwar.
You know. And looking at the nominations coming in, we are seeing there's a lady in Kitui. There's a lady in the places that we mentioned, you know. And we want for this to be out there, you know, countrywide. We want to distribute them countrywide. And we are hoping for the public once again, because we can't do this alone. And we are saying, as you've mentioned, it's something that affects the whole nation. You know, we're asking for the support. I don't know if I may say how guys are able to come on board.
Sure. Give us the M-Pesa number.
So the process of how people are able to come on board is one, we're asking people to nominate. Because without these women, we wouldn't have breasts to give. And we know that we have an understanding that the need is there. So we're asking to nominate by sending the word submit to 21207. Submit to 21207. This will prompt a number of questions. There's 3 questions where you give the name of the nominee, or that is the person who is in need of a mastectomy bra. And then the secondly would be the location, because you need to know where they are so that we can do a good mapping out. And thirdly would be the number so that we can get in touch with them. And then the second thing would be supporting us. We need to deliver these things, so we are asking the public to support us by sending as little as 100 shillings to...
How much are these bras?
That's the funny thing. The bra itself costs between 3,000 to 5,000.
Wow.
And then the prosthesis goes to up to 30,000.
Wow.
And that you can imagine that cost after somebody like a situation of Susan. She underwent the mastectomy, which was costly, and then she had to go through chemo. You know, 6 sessions that are really costly, and then you're left with, I have a diet to maintain now. How would that play? Will I buy a bra? Will I buy a prosthesis? And you know, some women have gone ahead and bought the prosthesis without the mastectomy bra. But as hearing stories from the cancer survivors, they're saying if you do not have these mastectomy bras, they might fall out. Actually, as funny as she was telling the story, Susan was saying there's a time she was pouring tea for visitors. At the time, she didn't have a mastectomy bra. And you could feel it coming out. Exactly. And so that's why we're asking the public to support us.
Wow.
Yeah.
And you know what? I actually feel challenged. I'm going to buy a bra for
Please
someone.
do. Adopt a bra. That's what you're saying.
I want my social media followers to tweet me. No, just nominate someone. I'm going to buy a bra for them. So just go right on my DM and just talk to me. I'll be able to buy one.